All right, let's jump into a deep dive on Presibo. They're a health tech startup looking to kind of shake up healthcare in Nigeria. And we've got their pitch deck to work from. Their ambition is pretty clear right from the get-go. They're talking about a future where every Nigerian, doesn't matter where they are, has access to good quality healthcare.
It's a huge goal, that's for sure, especially given, the healthcare challenges in Nigeria. What really struck me reading through this pitch deck is how directly Presibo confronts those issues. They just lay it out. The reality is, right,
Okay.
millions of people can't get healthcare when they need it, preventative care, it's often not working the way it should, and then there's the whole infrastructure thing. Not enough data sharing between facilities.
Yeah, those points definitely stand out. And then there's that statistic they highlight, 94.5 million Nigerians, they're living with diabetes. And on top of that, another 11.7 million with high blood pressure. I mean, those numbers, they just scream that things need to change.
Absolutely. We're talking about a massive part of the population dealing with serious health risks. It really brings into focus, the potential impact Presibo could have.
So let's get into how they actually plan to do this, right? How's Presibo aiming to make that change happen?
They're going the technology route. Specifically, they're using AI-powered diagnostics and remote monitoring tools. What they're trying to do is deliver healthcare services in real time wherever the patient is. Basically, they're saying, okay, we can use technology, the internet, to bridge the healthcare gap.
That idea of reaching people, especially in remote communities, using tech to overcome the distance barrier, that's fascinating to me. But what also stood out was how much Presibo talks about empowering patients. It's not just about giving them a digital platform, right? It's about giving them the tools to be in charge of their own health.
Exactly. It's a real shift. Instead of just reacting to problems, it's about being proactive. And that could be a game changer, especially in places where you might not have a doctor or clinic nearby.
Okay, so let's talk specifics. What's the Presibo platform actually offering to users?
So they've put together a whole suite of features. There's the continuous healthcare portal. That's a big one. Patients can use it to manage their symptoms, keep track of all their health data, and even communicate with their healthcare providers.
It's like having a virtual health assistant in your pocket, right? Available anytime.
And speaking of virtual, didn't you mention they also have a remote patient monitoring system?
Yeah, exactly. That one lets healthcare providers keep an eye on a patient's vitals, their overall health status, all from a distance. It really opens up the possibility of ongoing care, even for people in those harder-to-reach areas.
So it's not just about giving patients more control, but also giving healthcare providers tools to reach more people. But with all this information being collected and shared, what about security?
Yeah.
That's got to be a concern, right?
Yeah.
Oh, for sure. Data privacy is huge. And Presibo addresses that with their patient data management system. It keeps all that information secure, and it helps with sharing records between doctors and other healthcare folks. So it streamlines things, but it does it responsibly.
There, that makes sense. Now, we can't talk health tech and not talk about AI. Where does AI fit into all of this?
Oh, they're using it in some really interesting ways. Like, they've got this AI virtual assisted diagnosis tool. It can give healthcare providers diagnostic support in real time. And that could be really important in situations where you don't have easy access to specialists.
I can see how helpful that would be, particularly in those rural areas. Think about it. A doctor in a small clinic, maybe they're not sure about a case. They can consult with this AI system, get a second opinion, maybe even life-saving advice.
Absolutely. And it's not just diagnostics. They've also got personalized medical alerts. So their system sends out reminders for medications, appointments, even stuff like exercise and diet. It's like a built-in health coach on your phone.
That level of personalization is pretty impressive. It really shows they're serious about this proactive healthcare thing. Though I do wonder, could it be a bit much for some people, getting all these alerts and reminders?
Yeah, that's a fair point. I think it'll depend on the person, how they like to manage things, and how well it all integrates into their life. But the potential is there.
For sure. Okay, shifting gears a bit, what about emergencies? Does Presibo handle those too?
They do. They have an emergency response service,
Uh-huh.
and it uses geolocation tech, so they can get help to people quickly.
That's a crucial piece, having that safety net. So they've really thought about a lot of different needs and situations, but all this data they're gathering, it's got to be used for something, right? What are they doing with it?
Well, they use data analysis and visualization tools. They're looking for trends and patterns in all that patient data, so they can learn more about the health issues affecting people and hopefully improve healthcare outcomes overall.
It's not just about individual care, then. It's about using that info to benefit everyone. That's an interesting approach. Let's talk about who all this is for, though. Who are they targeting with these services?
They've got a pretty diverse target audience. Obviously, people managing chronic conditions like diabetes and high blood pressure, they'll benefit a lot from things like remote monitoring and those personalized alerts.
Makes sense, especially with how common those conditions are in Nigeria. Who else are they focusing on?
Primary healthcare patients, people who are generally proactive about their health, wellness enthusiasts, you could say, even patients with terminal illnesses.
Wow, so a really wide range of individuals. What about healthcare providers and institutions? Are they part of this too?
Oh yeah, they're a key part of their target market. They're working with hospitals, pharmacies, labs, offering solutions to make their services better, improve patient care.
So it's not a one-size-fits-all approach. They're recognizing that different people need different things.
Exactly, and I think that's a strength. They're not pretending the healthcare landscape is simple. They're offering solutions tailored to different parts of the population.
Right, we've talked about the problem, the solution, the features, who it's for. Now, let's talk business. How does Presibo actually make money? What's their model?
They've got a few different ways they generate revenue. One big one is monthly subscriptions, so people pay to access the platform.
That's pretty standard for software as a service, right? What other revenue streams do they have?
On top of subscriptions, they also have software licensing fees and data storage fees. Plus, they're getting into data analytics services, basically selling the insights they get from all that data they collect.
So they're making money from the platform itself and from the data it generates. That's clever. Any other potential revenue avenues they're looking at?
They've mentioned exploring partnerships and maybe even some advertising down the line.
Sound like you're building a pretty solid business model, one that can grow as their impact grows. Speaking of growth, let's talk market size. We've already touched on how many people in Nigeria have diabetes and high blood pressure. What else makes this market attractive for a company like Presibo?
Well, Nigeria's got a big population and it's growing. Over 22.5 million people in the workforce and 60 million primary healthcare patients. That's a lot of potential users for Presibo.
Those numbers are definitely compelling. What about the healthcare infrastructure that's already there? How does that play into things?
So Nigeria has almost 40,000 doctors, over 40,000 hospitals and clinics, and about 19,000 pharmacies. It's a decent starting point. Presibo's platform is about improving that system, making it more accessible, especially in areas where it's lacking.
That makes sense. They're not starting from zero, they're building on what's already there. But they're not the only ones in this space, right? What's the competition like?
Oh yeah, the African health tech market is getting pretty competitive these days. Presibo's got rivals, companies like AfraHealth, Helium, Checkit, HealthTracka, CridMD.
What are these other companies focusing on? What are their strengths?
Each one has its own kind of niche. Like AfraHealth, they're big on remote monitoring. Helium's all about preventative care.
Okay, so different approaches. What about the others?
Well, Checkit, they use data visualization to show health trends. HealthTracka, they specialize in telehealth. And CridMD, they're known for their AI-powered virtual diagnosis, kind of like Presibo.
So it's a busy market, lots of players, and that shows how much interest and investment there is in health tech in Africa.
Definitely. It's an exciting time to be watching this sector grow and innovate.
Okay, every successful company needs a good team behind it. Let's talk about the people leading Presibo. Who are the key players?
Well, you've got Jerry Enwobodo. He's the CEO and founder. Then there's Dr. Eni Ikedan. She's the chief medical officer. And leading the tech side of things is Sion Ayala, the chief technology officer.
Those are some impressive titles. Sounds like they've got a strong leadership team. What about the rest of the team? Who else is contributing to Presibo's success?
They've brought together a really diverse group of people with lots of different skills. Dr. Titi Adedeji is the Chief Operations Officer, Dr. Asuko Ekpeong's the Chief Research Officer, and they've got Imotu Onimo leading product development as the Chief Product Officer.
Wow, that's a lot of experience and knowledge in one room.
Yeah, and it's worth noting that each of these people has a really impressive track record. They're all clearly passionate about improving healthcare in Nigeria.
That's really inspiring to hear. Okay, we've covered a lot of ground. The problem, the solution, the features, the target market, the business model, the competition, the team.
It's been a pretty comprehensive look at Presibo, their vision, and how they plan to tackle this huge challenge.
It really has. But I'm curious to hear your take on the bigger picture. What kind of impact could a company like Presibo have, not just in Nigeria, but for healthcare innovation globally?
I think what Presibo is doing, it's part of a bigger trend we're seeing, worldwide. Using technology to bring healthcare to places, to communities that haven't had it as readily available. And seeing how they're doing it in Nigeria, it's fascinating.
Yeah, it does feel like They could be a model for other regions that are facing those same kinds of challenges, like a blueprint for how to use tech to make healthcare more accessible for everybody.
Exactly, that's a good way to put it. It's about giving whole communities the tools to be in charge of their own health, no matter where they are or what their situation is. That's powerful.
It's inspiring, for sure. But let's get real for a second. There got to be some hurdles along the way, right? Trying to implement something this tech-heavy in a place like Nigeria, I imagine there are challenges they'll have to face.
You're absolutely right. Infrastructure, that's a big one. For their platform to work, you need reliable internet and you need electricity. And in some parts of Nigeria, those things can be spotty.
Yeah, that's a critical point. I mean, their whole model depends on technology working. So if a basic infrastructure isn't there, that's a problem. And what about the people? Are they ready to embrace technology as part of their healthcare?
That's another thing to think about, building trust, educating people about the benefits of this kind of technology. That's going to be key. Presibo's got to prove that their platform is worth using, that it's reliable, if they want people to buy in.
Right. It's not enough to just have the tech. People have to understand it and trust it. And then there's the whole regulatory side of things, too. I bet navigating that can be pretty tricky, especially in healthcare.
Oh, absolutely. Healthcare regulations, data privacy laws, they can be complicated, and they're different everywhere you go. Presibo's gonna have to stay on top of all that, make sure they're doing things by the book, especially when it comes to data security and patient privacy.
So there are definitely some obstacles to overcome. But when you look at what they could achieve, it seems like it's worth the effort. Let's say Presibo succeeds. Do you think this model could be replicated in other countries that are struggling with healthcare access?
I think it definitely has the potential to be adapted and used in different settings. The key is to tailor the technology and the approach to each community. You know, what works in Nigeria might need some tweaking to be successful somewhere else.
It's like creating a framework that can be customized. That's pretty cool. It's exciting to see Presibo kind of leading the way, showing what's possible when you use technology to tackle these big healthcare needs.
And they're doing it in a way that puts the patient first, gives them more control, makes them a partner in their own healthcare. That's important.
This whole deep dive has been eye-opening. We've talked about the problem, the solution, the features, the target market, the business model, the competition, the team. It's been a lot.
It has. But I think it gives a good overview of Presibo's vision, and how they're approaching this really important issue.
Definitely. But I've got one last question for you and for our listeners out there.
Go ahead.
Thinking about all this, about Presibo's technology and how they're using it, how do you think these innovations could impact healthcare in your own community? What are the possibilities, but also what are the potential problems you see?
That's a really good question, and it's one we should all be thinking about. Technology is changing everything so quickly, and healthcare is no exception. What we're seeing with companies like Presibo, it's just the start. It's exciting, but it's a little daunting too.
I get that. I mean, the potential benefits are huge, but we can't ignore the downsides. We have to be careful, thoughtful about how we use this technology. It has to be ethical. It has to put people first.
Absolutely. Technology has to serve us, not the other way around. But if we plan carefully, if we make sure everyone benefits, then we can use these advancements to create a world where everyone has access to quality healthcare.
Couldn't have said it better myself. And on that note, I want to thank you for joining me for this deep dive into the future of healthcare, and a big thanks to all our listeners out there too.
It's been a pleasure discussing all this with you.
We hope you'll keep exploring these topics, keep thinking about them, share your thoughts. There's so much more to discover as technology keeps changing the world around us.
Wow, that was a lot to take in, wasn't it? We went from like the nitty-gritty of healthcare problems in Nigeria all the way to some pretty futuristic solutions. And honestly, I feel like we've only just, dipped our toes in the water.
I know, right? It really makes you think. What Presibo is doing, it kind of gives you a peek into this future where technology is like the heart of healthcare. And it raises a lot of questions about, how that's going to change things for Nigeria and for everyone, really. It does. And for our listeners, we hope this has gotten you thinking too. Keep digging into these ideas. Think about what could work, what could go wrong, and maybe even, imagine how this kind of technology, like what Presibo's building, could change things in your own community.
It's been great talking all this through with you.
Thanks for sharing your expertise. It's been really valuable. And to everyone listening, thanks for joining us for this deep dive. Until next time, stay curious.